Hi, I'm Dr. Premila. I'm a pediatric dentist and practicing exclusively child dentistry since 2009. Nowadays, most of the parents, plan and have a child. So I would really suggest to all the parents, especially the ladies who are planning to have a child, to get a thorough dental workup done because there are a lot of studies which suggest that the mother's dental health, just the dental health, is related to child's health during birth. According to the American Academy of Pediatric Dentistry, it is at 6 months of age or when the first tooth erupts, but not later than 1 year. Yes, milk teeth play a very, very important role. Firstly, it helps in chewing because we've seen kids with multiple cavities on their molar. The diet is very, very less and they don't even gain weight. So once it's sorted, you see a significant increase in the appetite, better eating habits, and even the weight increases. Secondly, the front teeth help in speech and aesthetics, and the other thing is it maintains the space for the new tooth to come. So it is very important to make sure the teeth are healthy. And there's one more common misconception is parents sometimes we think that milk teeth start falling by 6 and maybe by 7 or 8 they should all be done, but no, milk teeth start falling at 6. That's only the lower front. The upper front fall around 7 to 8 years. The molars fall around 9 to 11. The last ones are the canines, which fall around 12 to 13. So though this starts at 6, this is a whole process which continues till 13. So it's very important to keep them healthy. Okay, let's take the first thing. What we as parents can do at home. Take care of whatever we feed our children. Anything, just we ourselves should eat and see first. And we as adults will instinctively know where food is stuck. So if it's sticking in our teeth, it's going to stick in a child's teeth. It's just going to stick for much longer and it can cause cavities. Second is brushing. However difficult it is, we should make it a habit to brush the child's teeth twice daily. The earlier we start, the better it is. Thirdly, a regular checkup. Whether the child has a cavity or not, it is advisable to get the child checked once in 3 to 4 months. So the second point is what we as dentists can do. The first thing is we can do a thorough diet analysis where we go through a child's diet for over a period of a week and see if there is anything given at any particular time which could cause cavities and explain it to the parent so that they could change the time or clean the child's teeth after that. Secondly is we can do something called as fluoride application, which is better if it is done in a child, let's say around 4 onwards. It should be done twice yearly to see its benefits significantly. And third is sealant application, where we flow a filling material into the molars of a child's tooth, that is especially into the grooves where the food usually gets stuck and causes a cavity. Sealants can be done in a child as young as 3 years. As soon as the molars erupt and we see that this child could be prone for cavities, it is better to get their teeth sealed. And the third part is what schools can do. Apart from having a routine dental checkup and talk on oral health, they could also take care of the snacks and the juices that they provide in school, and train the ayahs to probably at least rinse the child's mouth or clean it up after every snack. I think mouth guards should also be made mandatory, how it is in most of the countries, while contact sports, because a lot of the sports are coming down to our country also. And apart from that, especially there are chances of the whole tooth coming out in maybe a 7-year-old, 8-year-old. This is called as avulsion. So the two most important thing in a case of avulsion is how do you carry the tooth to the dentist and how soon do you visit a dentist. So it is best to carry it in a milk, in a container containing milk, cold milk, and it is as soon as possible you should get the child to the dentist. Then there are higher chances of doctor being able to put the tooth back into the child's mouth and stabilizing. The second thing is whenever there is chip, like a tooth is chipped off, and even in that case the immediate x-ray and the treatment plan is very important in avoiding extensive treatment later. The brush and paste that we need to use will depend on the age of the child. So for a newborn till say the first tooth erupts, it's better the mother wipes the child's gums, okay, clean after every meal with a gauze or a clean cotton cloth. And from the first, when there's only say one or two teeth, it is better to use a finger brush so that we don't hurt the gum. And then when you see more number of teeth in the mouth, it is better to use a proper baby brush. And the paste that we need to use, it depends on the fluoride content. Fluoride is the most important, component what helps us decide on which paste to use. So for babies, we need to use a zero fluoride paste or a fluoride-free paste. Then when the kid turns around 5.5, 6, we can use a mildly fluoridated paste like, which should contain fluoride between 300 to 500 ppm. And for older children, we can use the adult paste that is about 10 to 12 years. The most important brushing techniques would mainly depend again on the age of the child. So for a child who's below 3 years, it is better to use a lap to lap technique where two people sit and brush the child's teeth, because it gives good control over child's movement and good visibility, because it is very important that we see all the surfaces of the teeth when we brush it. But if it's not possible for both the parents to be there, then we can make the child sit on our lap and brush it. But again, make sure that you're holding the child properly, because if the child suddenly moves, they may hurt themselves when you're trying to brush really hard. And for older children, maybe around about 3 years till around 7, 8 years, the child would be really enthusiastic to brush by themselves. So you can let them do it, but you should always brush the child's teeth after that, especially the upper molars and the behind area of the teeth, which the child usually doesn't clean. And maybe for 10, 12-year-old child, you could just supervise the brushing. And in initial stages, train the child how to brush. Like they have to brush their upper molars, then the front and the back, then again all the lower teeth, inside, out, clean their tongue, so that you get them into the habit, and later you could just supervise their brushing.